If you are anything like me, you have a little bit of anxiety about taking care of the critically ill pregnant patient, I figured that I could share 3 tips with everybody that I think about every time I go into one of these scenarios. Tip number 1, and probably the most important thing to remember, is that our resuscitative efforts are gonna focus on mom and not on the fetus. The better we resuscitate the mother, the better the outcome is gonna be for both of the patients. Tip number 2 is about vascular access, and of course we wanna have 2 large bore IVs, but we wanna have them above the diaphragm in these patients. The uterus can compress the IVC, decreasing pulmonary venous return, and that can impede medications, fluids, or blood products from reaching the heart. I love femoral lines and tibial IOs, but this is one place where I'm gonna avoid those lines. That leads us into tip number 3, which is again about that uterus compressing the IVC, and what we wanna do is displace the uterus from the IVC to improve venous return. The old way of doing that was to tilt the patient into left lateral decubitus, but that actually makes resuscitation a little bit more difficult. Instead of that, leave the patient flat on their back and manually displace the uterus off to the left. That's gonna relieve the obstruction from the IVC and improve venous return. So there are 3 quick tips to think about every time you go into resuscitating a pregnant patient. And the most important thing for us to remember is to focus resuscitative efforts on the mom in order to improve outcomes for both patients.